Okay, great. So now I'm having Jane hold it with pressure because that is, in my opinion, very, very important. And if you keep the pressure long enough, you're very unlikely to bruise. And you don't have to be gentle with this pressure. So she's holding it for me, and I'm getting ready for the other side. Now there's some foam. This is very important. I want to see this foam right here, and so this is going onto the top. It's gone to the top. It's going to be out of my way. This is useless foam methylcellulose. So I'm going to go right again in the red stopper between the two parts so I can see my needle. Okay. Now I'm getting it from there, and I'm getting very little methylcellulose. It's coming all the way down. I'm getting the full 3 cc's. Great. Okay. Jen, how are we doing?
Good.
Good. Okay, I got the extra foam out. Then we do it again, look through the whole syringe. You can see that there's nothing in the column. I wish there was, so I can show how tapping brings it to the top, and then you can kind of shake it out. There you go, there's just like one bubble, and now it's all primed. We get it, and we prime the needle again to make sure that, there you go, 1, 2, good. So this is flowing very well. Now we'll go to the other side. And we do exactly the same thing on this side as well. Excellent. If you notice, I applied the pressure immediately in the area where I saw that maybe there was a tiny bit of blood oozing, because that will stop it from spreading. Good. And without taking it off, I'm going to have Jane hold it with her hands. Good. Jane, how are we doing?
Good.
Excellent. Now, if I had the assistant with me, I would have the assistant hold it, and then I would go on to the other areas. But since I don't have, I'm going to have her hold it for about 3 minutes by the wash to make sure that we have good pressure. And then I'm going to resume the injections in the other areas in 3 minutes. Okay, so I'm filling it again, and as you can see now, the volume is going down slowly and gradually. I enter again, and when I'm turning it upside down, the foam is on the top, and that's great. It's out of my way. And I'm getting about 2 cc's out, because that's what I need for the right side now. And I got it. Okay, and at this point I'm switching the needle to a new needle, because even without any trauma, the needles can get blunt pretty fast. I just shake it. You can see the drops flying out. Don't worry about it, that's good. Getting all that cellulose out, and getting all the little bubbles to coalesce into one big bubble, and bringing it up. See the bubble? Beautiful bubble. There you go. One more bubble. There you go. Now it's a good flow. So now I can put it on, and now I can prime my needle. 1, 2, 3. Good. So we are primed. And now we'll go on to the right side. Jane, you can take the right hand down now. Great. And I'll let you hold this. There you go. There you go. Perfect. I'm going to turn you around this way. And I'm starting with this jawline that I'd marked. I'm going in under the skin, subcutaneous, and I'm just gently filling it up right here. Perfect. This is done, and now I'm going to go into the marionette chin triangle. I'm going to bother you again to hold pressure right there. Good. Almost like you're squeezing your chin, so use your thumb as well. You're squeezing this. Perfect. Thank you. Thank you. Now I'm just going to hold pressure a little bit here for just a minute. When we were actually off the camera for a second, Jane told me that she forgot to stop her aspirin. She takes an aspirin, and you can see that despite that, she really doesn't have any bruising here. And that's, partly because of the pressure, partly because she's calm and relaxed. So I've had those incidents, and in those cases what I do is I tell the patient, please take the day easy. No activities during the day like working out or running around all over the place. If you can just relax and ice as much as you can, that'll help. One thing which is a big no-no is workout. A lot of patients come on days when they're off and they try to combine everything into one: dentist appointment, gym, coming to me, and not a good idea. Especially when you work out, it is good for your health, but now you've got vasodilation going on all over with a little bit of increased baseline heart rate and increased heart blood pressure as well. Those are set up for increasing the bruising because your circulation is really pumping. So that day, you really should not be doing any workout. Okay, as we get near to the end, we have a little bit of more foam collected here, and I'm going to use all the rest for the left side now. So with the gap between the red rubber stop, I can see what's going on. I can see my needle tip, and I can start withdrawing to see how much I have. One of the reasons I mark what I'm going to inject is because you can end up running out of material when you get to the last area you're going to inject, and that can be very troublesome. Great. So I got it all. You can see this is all foam in there. This is useless. Don't worry about it. This is not material that you're losing. I'd rather not have it at all in the patient, and there you go. So now I have what I need for the other side, and it's exactly 2 cc's. Okay, we did a tap tap, getting the air bubble out. Good. Easy flow. Sometimes when the material comes out, it can be slippery, so be careful. If that happens, that you feel like a syringe is getting slippery from the material flowing over, dry it up quickly because you don't want to have a slippery syringe in your hands. Okay, when that's done, you prime the needle again every time. Good. Nice flow, and now we can go to the other side. Jane, you can take this down in your hand. There you go. Very good. I'm going to turn you around a little this way. Very good. We'll start with the angle here. Now I'm in the skin subdermal, and I do all these injections subdermal, never the dermis, because dermis is where you are very likely to get nodules, and we don't want that. So we're done with this. I don't go near the periosteum either, because once you're either on the periosteum or supraperiosteal, you might hit it and start an inflammatory process of the periosteum that leads to a bony type of nodule, almost like a benign osteoma. And those you really cannot treat very aggressively. There's really no solution except for waiting for it to go away or camouflaging around it. So it's very important to stay out of it. In the beginning, when I was doing the temple areas, sometimes I would hit the temporal fusion line right here. That's where you get from the deeper area full of soft tissue to the superficial area which only has frontalis muscle, not much. And that's where the nodules would happen from the bony stimulation. So I realized I really don't have to get too close to that. So once I feel the temple area and the deep area, that is plenty. And I try not to get too close to this area. And I can still get a little bit of brow lift by staying in this area. The volume lifts it up. And that usually is plenty, and it minimizes the crow's feet as well. Again, subdermis, some people would tell you here that you should go all the way to the bone. Not a good idea, because there's always a little bit of vein in here as well, and if you hit the bone, you can get an osteoma there as well, and you'd rather stay away from it. Jane, I'm going to have you hold it here. So, in essence, we did all the areas we had to do in a pretty atraumatic way, and it was very quick. It didn't take too long, and the pressure application ensured that we won't have any excessive bruising. At this point, after another 2-3 minutes, once she's held the pressure, then typically I'll have the patient do icing for 5 minutes. And at the end of the icing, I will come and massage it gently with a little bit of moisturizing cream so the skin is not traumatized, just to even it out. At this dilution of 10 cc's, I do not like to massage aggressively because I'm afraid I might spread it out too much. And I don't get nodules from this typically, and I'm not concerned about that because the dilution is so high. And even if I do get any nodules, those are more like papules. They're very tiny, 2 to 3 millimeters under the skin, and slowly and gradually they go away on their own. If a patient brings it to my attention that they have noticed something on the massage, I tell them to massage it aggressively and try to break it down. And if it is not going away, then come see me, and I will use a combination of a very small dose of Canalog, only like 1 milligram, mixed with a little bit of saline into the nodule and try to break it up, the papule, and it gets better. Even if it does not, I do not get too aggressive with it, because I tell the patient it is about the way you look, not what you feel. It's like a rhinoplasty. Patient might feel something and say, I feel a little irregularity or something. However, we do that for the looks, not for the feel. So if it looks good, leave it be. Slowly and gradually, that little papule will go away. So it has not been an issue. So at this point, how are you doing actually? I should ask her instead of speaking for her. You feeling okay? Great. Any problems? So you're pretty comfortable, you would say? Excellent, excellent, great. Good. So please remember not to do any workout today, and if you can skip today's aspirin, that would be great. And I'll have you do some icing after the next 2 minutes, and then we'll talk more.